More signs Obamacare is failing today as news of more glitches surface. We now know less than 1% of those who visited the exchange were able to enroll for health care coverage in the first week it was open. Now, speculation the problems could spur the law's biggest booster to delay the individual mandate. Joining me now, Dr. Kevin Campbell, a cardiologist and assistant professor at the University of North Carolina. Chris Jacobs, a senior policy analyst at the Heritage Foundation. And Dr. Sridhar Puttaratsu, the CEO of Vital Springs Technologies. I want to go to that news, the expectation by at least some that the president might drop the mandate. Here's what Congressman Tim Huelskamp had to say. Listen to this.
We are glad that we outlined the difficulties with Obamacare. We took a charge at this, and we fell short. But at the end of the day, I think we lost the battle, but we're going to win the war over Obamacare. I think it's entirely possible that soon after we finish here, the President of the United States would announce that he's going to delay the individual mandate. And that is one thing we've been fighting for.
I got to tell you, that came to me as a shocker, Dr. P, that the president might delay the individual mandate. Do you think it's a possibility?
It has to be a possibility, Jerry. If the president is listening tonight and we give him the examples of just beyond the difficulties of enrolling into the website, the kind of erroneous data that is coming out when you actually get through should put an immediate stop to this. And let me give you an example. A colleague of mine who makes, six figures, signed up for the website to try to purchase insurance in the state of Virginia. There is a plan with a major insurance company that is offered through a major healthcare system. I won't mention the names, but the output that came out was that his monthly premium was going to be in excess of $8,000. It's about $8,500. His monthly
I got to tell you, so you gave me this. This is information he got from the website that he was trying to sign up on. So a monthly premium of $8,504, a deductible of $12,700. Right. So we're talking about money that even if you make six figures, my friend, you're not going to be paying that. Does this surprise you? Is this an error, or is this really the cost?
No. It is not. It is clearly an error, and this is the problem. They've said before that some of the calculators that have to give the outputs have been flawed. The states have been talking about this in terms of the calculations they need to make based on the inputs. Right. The other issue, based on today's op-ed in the Wall Street Journal, elucidates this very well, that the reason they're having difficulty in reporting on the numbers is because of the enrollment figures. The exchanges, along with the Federal Data Hub, have to exchange information from a form, not to get technical, called the 834, which is a daily update on enrollment.
And the upshot of that is that insurers are not getting the information they need.
Right.
Let's get back to that. I want to let other people into the conversation. Chris Jacobs, to you. Huelskamp says we may delay the individual mandate. Do you think that's possible?
Well, the American people are certainly looking for relief from Obamacare. And it's certainly an issue, because why can you force the American people to buy a product that they can't even access? That you're forcing people to buy health insurance, but you can't access the website.
You can't access the website, and there's a deadline. And if you don't meet the deadline, you're breaking the law. What do you make of that, Dr. Kevin? Tell us what you think of that.
Well, I think the whole problem here is the fact that the website was designed to not allow you any information on cost until you were registered. And it was done with intention, in my opinion, because if you actually saw cost data, you wouldn't sign up. You'd run away. And I think that is part of it, because politically, I think the president would like to be able to brag that he's got this many people signed up. Unfortunately, it was rolled out when it was not ready to be utilized, and no one can sign up.
Well, and that brings us to the company that actually put this thing online, and I want to talk a little bit about that. It's a company called CGI Federal, and you wondered who was behind this website that works so poorly, right? Well, it's not an American company, it's a Canadian company. Right. And what's more, they have spent over $800,000 lobbying Washington to get in on this. Dr. P, what do you make of this? Have you heard of this company? Do they have a big history in your industry?
We've heard of them. So they are a, decent-sized federal contractor. I have less issues with the fact that maybe they're Canadian, but I think that the issue here is the expertise in knowing how to bring together all of these systems. And I can tell you confidently that none of the systems integrators in the business, it doesn't matter who you are, have the kind of experience that was necessary in order to execute on bringing together the kinds of systems to talk between insurance companies and the federal data system. And there's enough people that even attest to that as advisors to the White House that now say that on conference calls there were any number of warnings that were given and concerns to say that they were not ready.
They weren't ready, and yet they kept throwing money at it. As a matter of fact, Chris, I want you to respond to this. Apparently, it cost a quarter of what it cost to develop the Obamacare website as it did to develop the first iPhone. Now, sit back and think about that. How transformational was the iPhone? What a big deal that was. They spent a quarter of the $600 million that we've spent rolling out Obamacare on that. What's going wrong here? What is your analysis?
Well, you're exactly right, Jerry, and they kept dumping money, more after more, good money after bad, this year as everybody knew the exchanges were well behind schedule, all sorts of logistical problems. I think it shows the problems you have when government tries to interfere and contract out. You don't see Google bidding for these kind of contracts. You don't see Amazon bidding for these kind of contracts. Instead, you have companies whose job it is to win government contracts and go off the government dime.
But that's all they do.